We should do all these settings beforehand. Last moment we should not try. So it is setting up. It will take a few seconds. Yeah, it is live now. Yeah, so shall we start? I can't hear you. Arti, you can try joining in from Zoom. I think your system has some issues, so you can try one more login from the Zoom and just see. So good morning, everyone. Please confirm if you can hear me and see the slides. And we'll begin in few seconds from now. Good morning, Monu. We'll just begin in few seconds from now. Please stay connected.
Hello.
Yes, Arti, I can hear you now.
Yes, sir. Hello. Am I visible also, sir?
Yes, very much. So, what do I do? You want me to start the session, or you want to give a background to the audience?
Sir, let me give a background first.
Okay, so what I'll do is I'll just stop sharing the screen. You can just give a background.
Sure, sir. Okay.
And then we'll start. Okay, perfect. So I'll
Okay, sir.
stop sharing the screen. You can give a background and then we'll begin.
Okay. Thank you, sir. Good morning, everyone. And sorry for the glitch. Actually, there were some technical issues. And welcome back to Simple Pharma Basics. And thank you so much for joining. As you all can see from the title of this video, this session is going to be all about medical writing, various career opportunities in medical writing. And we will have the guest speaker as Manoj Kumar Yadava, sir. He has done his B Pharma from Government College of Pharmacy, Bangalore, and later on he continues his M.Pharma in pharmacology from the same institute, and now he's working as a medical writer. And throughout the video, he is going to discuss many things about the scope and how to do, how you can start your career in medical writing and everything. And later on, at the end of this session, you can ask him the live question, and he's here to answer all your questions. So without much delay, let us welcome guest Yadava, sir. And thank you so much, sir, for taking your time for us, for my audience. I want to thank you on the behalf of my audience. And with this note, I would like to hand over the meeting to Yadava, sir.
Thank you so much, Aarti. Thank you for that nice introduction. Perfect. So what we'll do is we'll begin this session directly. We are already a little late. So the topic
Yes,
of topic for today is careers in medical writing, and I'm here, to speak about the same topic here. And just a little bit about me. Of course, Aarti told me more about me, but then I would like to, give some background, add a little more points to that background. And Is my screen visible, Aarti?
Hello.
Is
You
my
are visible,
screen?
sir.
No, no, my
You are
screens
visible.
are visible. My screens are visible.
No, your screen is not visible.
Yeah, okay. So let me start sharing the screen and then I'll begin. Yeah, perfect. So I'm just sharing the screen and just confirm me once it is visible.
Yes, sir. It is visible now.
Perfect. So we'll begin. The topic is careers in medical writing, and why I'm here to speak on this topic, because I have been into medical writing for the last 15 years, and I feel I have enough knowledge to and information to share with you today. So this is where we'll begin. Yeah, and little about me. Already Aarti told about me, but then let me just talk about me a little bit of that. So I did my B Pharm and M Pharm from Government College of Pharmacy, Bangalore, and I have been into medical writing, medical communications, and IT solutions for pharmaceutical industry and hospitals for the last 15 years. I have been a mentor, coach, and a resource person for this program that we do in Karnataka called Pharma Disha. This program is jointly conducted by Karnataka State Pharmacy Council and the Rajiv Gandhi University of Health Sciences, Bangalore. And this is an orientation program that we do for MPharm students for 2 days, 2 days intensive training program when they join MPharm course. The objective is to help them understand what is MPharm all about, what are the different things they have to expect in MPharm, what are the different career opportunities in MPharm. So it's a innovative, unique program that is for the first time started in Karnataka for pharmacy students, and it's a unique program, and I'm really proud to be part of that system and program. And I'm a technical advisor to some of the pharmacy councils in India, and I'm also the editorial board member of Drug Information newsletter that comes every 3 months from Karnataka State Pharmacy Council. Okay, so that was all about me, and I do a lot of sessions for pharmacy students every Saturday, 2 o'clock. I conduct pharmacy related opportunities, career related opportunities related webinars. Today also I have a webinar on my YouTube channel. You can watch that live at 2 p.m. We'll be discussing about resumes and what kind of considerations we should take to ensure a good resume for our dream job. I also talk about digital footprints. Digital is the future, and whether we like it or not, we have to go digital. And I help pharmacy students and pharmacy professionals plan their digital footprint online. And this is very, very important. And I also promote LinkedIn for pharmacy professionals. I see a lot of pharmacy students are not using LinkedIn effectively. So that is why I conduct a lot of sessions on LinkedIn for pharmacy professionals. And you can watch a lot of recordings of past webinars on my YouTube channel as well. And I do training programs and webinars for on medical writing, just like this one we are doing for you. So, and I also do one-to-one sessions for pharmacy students and faculty members, and also for industry professionals. Why one-to-one, you may ask? Because our pharmacy students and professionals are shy, or they don't want to share and discuss in public. They want somebody to discuss with them as a one-to-one. So this is what I do for pharmacy students and professionals, irrespective of the industry and the qualification. For freshers and for experienced, both I do. And I've been doing this for a long time. Okay, so perfect. Let's come on to the topic. And the topic today is careers in medical writing. So first we should understand what is medical writing and then who is a medical writer, right? So medical writing is science or art of writing, where we communicate the complex scientific data into clear, concise, credible, complete, and compelling manner. So this is a concept of 5 C's that we use in medical writing, and the person who creates these documents or writes this content is called as a medical writer. Okay, and medical writing as such, it involves a lot of scientific documents of different types, which include regulatory, research related documents, disease related document, drug related document, promotional materials, magazines, healthcares, websites, blogs, so much of digital content. You see all these Instagram posts, Facebook posts, YouTube health related videos. So somewhere there are medical writers who are involved in the background of creating that content and the information that you are seeing. Okay, so this is all about medical writing and medical writers. And now let's see what are the different types of medical writing. Okay, so first type is of course the scientific writing, which is the basis of any kind of medical or health information or health writing. So what happens in scientific writing? Whenever an experiment is conducted at the lab level, preclinical level, all those information is written by scientific writers or medical writers at some point of time. Okay, and these then go for publications in journals, books, and other places. So that is when this publication writing comes into picture. We have something called as for medical writing, core medical writing, which is for the industry, for clinical trials, and for other places. We have clinical writing for clinical trials. We have non-clinical writing for different types of promotional and other things, patient narratives, and we have regulatory documents that are written. We have medico marketing, which is one of the most common type of writing that pharmacy students and pharmacy professionals are involved. And this type of writing is for promoting pharmaceutical products or medical devices to healthcare professionals and patients. Okay, so these are different types of writing wherein scientific writers or medical writers are involved, and this offers a unique career opportunity for a lot of pharmacy students, medicos, and other professionals who like to learn every single day, because medical writing is a profession where you get a chance to learn a lot of information, because every single day you'll be working on a new topic, you will be learning something new, and you will be enriching your knowledge and others' knowledge also. So this was about the different types of writing. And of course, the last one is the pharmaceutical writing, wherein we create all these SOPs within the in-house documents and contents for the pharmaceutical companies. Okay. So the different types of medical writers, different types of documents that medical writers write are, broadly classified into 4 types. One is clinical, the second one is regulatory, non-clinical, and safety. In clinical writing, we have these protocols, clinical study reports, top-line summaries, investigators' brochures, informed consent forms, case research forms, and all of that, right? And in regulatory, we have clinical overviews, justification documents, and efficacy summaries, and all of that. Similarly, we have non-clinical writing, wherein we have this clinical overviews, non-clinical sciences, toxicology related information, drug metabolism related protocols, and other things. And safety writing is for patients, wherein we create patient related information for healthcare professionals and others, right? And who can be a medical writer? So this is for pharmacy, B Pharms, M Pharms, and PharmDs. So B Pharms, they are not much preferred in as medical writers, but they can be beginner in medical marketing writing for pharmaceutical companies. Some of the pharmaceutical companies, they still hire B Pharms as basic medical writers. But the most important qualification for becoming a medical writer is M Pharm or a PharmD. Then we have medicine, wherein MBBS and all the doctors, they can also be medical writers. We have veterinary people, they also become part of medical writing teams. And others, BSc, MSc, other life sciences also. We have biomedical sciences people who also join as medical writers, okay? What are the different skills that we need? Okay, so this is a slide wherein I'll be taking a little longer time, and I'll try to explain one by one on the different domain knowledge that we need. So first domain knowledge that we need is, of course, the medical and the scientific knowledge, right? So if you are a medical writer, obviously you should know about different mechanism of actions of the drugs, the different drugs that work, pharmacology of the drugs, the development process, the drug development process, the safety and efficacy of the drugs, a little bit of statistics, and all these medical terminologies that are involved within the medical writing domain, right? So all of that you should be knowing. Then you should have good language skills. When I say language skills, of course, your grammar, your spelling, punctuation, your communication skills, ability to stop, ability to create good content from the complex scientific information that is available. Then you have to have a good creative skills wherein you can convert that complex information into a simple language, English language, or a different local language that you are working on. And don't feel that medical writers are only writing content in English. There are content writers or medical writers who also write content in the local languages. We have so many languages in India, and of course, to convey this complex scientific information into the local languages is again a challenge. So many companies still hire people who can localize the content for the audience. Okay, so that is when the language skills will come. And if you know a good, if you are conversant in both English and the local language of yours, then you can be a great writer. Okay. Then the next one will be the research skills. So a research skill will be wherein you will be compiling a lot of information. You will be doing a lot of literature search. You will be, creating up-to-date information from the current research. Then you will be verifying that information, whether it is suitable for that particular work that you are doing or not. Like, for example, if you are writing on Dolo 650, as an example, if I give. So Dolo 650, you may have literature for the past 5-10 years on available, right? But you may not be including all the 10 years data that is available. Probably you will be using only the last 3 years or 4 years data, which is the recent one or the latest one, which makes little sense for the audience. So that is when your research skills and understanding skills will come into picture. Then comes the analytical skills. So when it comes to analytical skills, you have this interpretation of huge scientific data. So for example, there is a research article which is published, which is about, say, 15 pages, right? So for that 15 pages document, you'll have to basically understand, and interpret it. You have to understand and interpret in your own simple language with the presentation and the statistics which is involved, and create the content for your target audience. Who's your target audience? The target audience can be a doctor, a nurse, a pharmacy professional, or even a patient. So these can be your target audience. So depending on the audience requirement, you have to basically create the content for that particular audience, right? And next comes the ethical and self-discipline. So this is the most important requirement when it comes to scientific communication or medical writing, because you are responsible for communicating facts or scientific information, right? And if you are not responsible and accountable for whatever you are doing, you are not accountable for what information or data that you are putting in, then it becomes a problem, right? So you have to be self-disciplined and ensure that you take your mental decisions and wisdom into account and create a content that is helpful for the larger audience, right? So even if there is a side effect of the drug, you should be able to communicate in a very nicer way and a better way so that it gets the information right to the audience. Okay. Next comes the personal skills. So you have a lot of personal skills. There are a lot of soft skills and hard skills which are there. And hard skills are the ones that you have already learned in the college life. And the soft skills include all these communication skills, computer skills and all of that, right? So these are all the skills that you can learn. Apart from that, your coordination, your teamwork, your interest, your focus, patience, logical thinking, all of that come into account when you become a medical writer, because you'll be interacting with multiple teams, and the way you interact, the way you behave, the way you work with the teams make a lot of difference. Okay. Next, IT skills are the most important, because today, everything all is on computers. We spend so much of your time on computers and devices, right? Computers and mobiles and smartphones and so many other devices. So if you are a tech savvy writer, then you can be easily adaptable to the latest updates and developments that happen. If you are not a tech savvy, then it can be a challenging for you to take into account so many new developments that happen. Like, for example, today a lot of people, say 70 to 90% of the audience are using the information on their smartphones. So if you are a medical writer and if you are supposed to create a content for a medical content for a medical update for a device or a smartphone, and if you do not know the basics of how the smartphone works, then you may not be able to customize the content for the smartphone. Like, on the website you can create huge amount of content with lot of images and figures and all of that, but small for the smartphone the screen size is very small. It is only 6.5 inches max, right? So you have to customize the content so that the users are not getting strained, at the same time they get the right information on the device. So these are certain things that we have to understand. Besides that, we also need to understand the different softwares that can be used for creating content. Like there are softwares for grammar correction, there are softwares for formatting, there are software for putting references in the document, like there are softwares for designing. So all these softwares, if you are able to use properly, then your whole presentation skill, the whole idea of creating a good content will be very, very nice. So I hope this is clear till here. Am I going too fast, Aarti? I'm just checking so that I can continue.
Hello?
Yes, Aarti, am I going too fast?
No, sir. No, sir. The pace is good. Yes.
Okay, so I'll take up the questions, at the end of the session. So hold on all your questions, and I'll try to answer the questions at the end of the session. Okay, perfect. So what are the career opportunities as medical writer? This was the topic, of the day, and this all that I spoke till now was just the background of the entire thing, right? So what are the career opportunities? So any medical writer can be employed in a company. And what are the different companies? We have biotechnology companies, we have pharmaceutical companies, we have contract research organizations. Biotechnology companies like Biocon, for example, they employ a lot of medical writers. They have their own in-house medical writing team. They have a medical affairs team. A lot of pharmaceutical companies, including Novartis, Sun, Dr. Reddy's, all these companies have their own in-house medical writers team. Novo Nordisk, they have their internal medical writers team, and they hire medical writers team so that they can get the information right away within the teams, right? And we have a lot of contract research organizations, IQVIA, Syngene, Clinigen, and LabCorp, right? These are all contract research organizations. So they also hire a lot of medical writers. Then we have agencies, right? The agencies which provide services to the pharmaceutical companies or hospitals, the agencies which provide services to as medical communication agencies for pharmaceutical and hospitals again, they also hire a lot of medical writers. So some of the agencies, the biggest agencies that hire medical writers is Indigene, BioQuest, you have Club Class, you have Sims India. Sims India was my first company where I started my journey as a scientific writer, and I worked with them for 6 long years. Okay. Then you have a lot of publishing houses which hire medical writers. Springer, one of the biggest one. You have Elsevier. In India, you have Medno, you have JP. So all these, publishing houses also hire medical writers because they have to create content for their journals or do editing of the journal articles or do create content for book chapters or books, right? So that is where medical writers come into picture. You have a lot of knowledge processing outsourcing companies where they hire medical writers for creating content and editing them. And then you have a lot of medical societies or scientific societies or even associations, right? They also hire, like for example, if I have to take example of Karnataka State Pharmacy Council, they also have within an in-house writer who creates content for their drug information booklet. They have this in-house writer who writes content for their books. So they also hire MPharms or PharmDs for creating content, right? And then we have hospitals and academic institutions who also do hire writers. Now, why hospitals will hire writers? Because they have these doctors who want to publish the case studies, who want to publish, write their articles in journals. They hire medical writers for creating the content. Doctors will not have so much of time. So the medical writers will be working in close association with these doctors, and they will be creating this content. Now, hospitals and other academic institutions have also started hiring writers because they want to do their online marketing. Now, without doing online marketing, no one can survive these days. You see a lot of advertisement of hospitals online on Facebook, Instagram, and other places. You all see all those designed posts and good content related to health and other things. they are created by medical writers at the background, at the back end, right? So these are then posted on the social media posts, or they are also posted as blogs on their website. So that is where you have the requirement of medical writers in all these different institutions. Okay, so there are different salary structure for medical writers. Of course, if you're a bachelor's degree, you can get up to 2.53 lakhs. If you're a master's degree, you can get up to 4 lakhs, 4.5 lakhs. If you're a doctorate or a PhD, you can starting salary can be 5 to 8 lakhs, per year. And this again depends on the organization, your skills, and so many other factors. The starting salary can be anywhere. Recently, one PharmD students got hired for medical writing position, and the starting salary he was offered is 30,000 rupees per month. So that could be the starting salary. It all depends on your skills and organization that you are joining in, right? So with this the whole objective of this session was to create a basic awareness about medical writing. So are you ready for getting into medical writing? There are huge amount of opportunities that are waiting for you, right? So all you need is to upgrade your skills, learn the right skills, and whatever you are studying, whether you are studying B Pharm, M Pharm, PharmD, or PhD, or doing PhD, please devote your time so well that you are well versed with all the basics and you know everything about what you are learning, right? And the rest of the things can always be learned. Once you join an organization, you can always learn the rest of the things there. But the basics is something which no organization will teach you, right? So you have to update your basics right when you are studying there. And then you can also start doing small projects related to medical writing by connecting with your institution, by connecting with the hospitals nearby, or also you can get internship with pharmaceutical companies or agencies. Okay, so perfect. This was all about the basics and overview of medical writing, and we'll take up some questions, and let's go. Let's see what kind of questions you have in mind. So I'm stopping my screen and sharing, and let's see if we have some questions. Yes, Arti, are you there?
Yes, sir, I'm here.
Yeah.
Okay, guys, so you can ask on your questions.
So this was the very short overview. When I do this medical writing sessions, it will be like weeks together, it will continue. This was just a very basic and overview, just to get an understanding. And I have done a lot of medical writing sessions on. If you can go to my YouTube channel, or you can connect with me on LinkedIn, you will find a lot of resources on medical writing. So keep checking those resources and keep upgrading yourself, because that is how you can help yourself and then help the industry as a whole, right?
Sure, sir, sure. Thanks a lot, sir, for all your information and the knowledge. We will wait for the students to ask the questions. Sir, one question was there.
Yeah, medical coding and medical writing. I just
Yeah.
yeah. So mono medical coding and medical writing are not the same, but they are very much related. Okay. So medical writing is a core content writing, whereas medical coding is you'll be coding certain things based on the template which is given to you. In both the places, your knowledge of scientific writing is needed, and your communication skills are needed. Okay. Yeah. Any other questions? We'll definitely take. Do watch the previous webinar recordings on my YouTube channel. You'll get lots and lots of idea. There are 40 plus career opportunities with respect to pharmaceutical industry. You can find them. All of them is available for free on YouTube channel. So just go and check them out.
Yes, sir. I will share the link of your channel in the description of this video.
Perfect. Okay, perfect. So for all of you who are watching this, check out those videos, because they'll definitely help you out. A lot of disturbance is coming.
Sure, sir.
Yes, perfect. So I also invite you, if you are interested to learn more, you can join me at 2 o'clock today. I'll be talking about how to create a good resume. So if you are a job seeker or you are planning to search for jobs, then join me today at 2 o'clock on my YouTube channel, and we'll discuss more about it.
Sure, sir. Sir, as you have said that students can prepare for medical writing from right from their B Farm or like
Yeah.
M Farm.
Yeah.
So, what are those qualities or what are those skills that they should improve so that they can go
Yeah.
into this field?
Perfect. Very good question, Arti. The most important skill is, of course, the subject knowledge. Domain knowledge is always the first skill that is needed, right? So if you are a pharmacy student, if you are in B Farm or if you're in M Farm, whatever subjects you are studying, focus on the knowledge part. Don't focus for the grades, focus for the knowledge, because knowledge is something which will always be there with you and you can apply it. Okay. Applied knowledge is most important. Theoretical knowledge does not help, right? And medical research and pharmaceutical research is a happening thing, so it changes, right? So whatever we learned in during our B Farm days, those research that is completely changed now, if I have to say. The mechanism of actions what we knew earlier has been updated. There is so much of new things are happening, so always keep yourself updated with the knowledge of the today's knowledge. And your communication skills are definitely the most important thing when it comes to medical writing. Your presentation skills are the most important thing when it comes to medical writing. Your IT skills, the way you use computers, what kind of softwares you use, how you use them, again, that helps you a lot. So since college time is something wherein you have exposure to a lot of resources, you have access to a lot of resources and libraries. During our days, we didn't have so much of information access, and even for internet, we used to go outside to cyber cafes to access internet for 1 hour, 2 hour, right? But now you don't have that problem. You can always access everything. So whenever you feel, even 1% of doubt in whatever you are doing, clarify those doubts immediately. Because if, say, for example, you are studying the mechanism of action of aspirin, and you just, wrote few times and you just remembered it, this is not going to help you. Understand how it works and why it works, and can certain things be updated there, right? Based on your understanding. Keep your value additions always ready, because when you start working as a medical writers, you will be reading so much of information, and your understanding skills, your analytical skills, and eventually your language skills to concise that whole information into simple readable format will be coming into picture. So spend as much as possible time in upgrading yourself. And one of the most important issues, that I see amongst the students is they do not want to share with each other. They just want to, confide everything with themselves, thinking that what if I share this and somebody else gets a better marks than them, right? So this is a very wrong notion, wrong understanding, because these things will not work out when you come out in corporate, right? Corporate is something, is it's all about sharing, and it's all about collaboration, it's all about teamwork. So start doing that right from the college. Even if somebody gets 2 or 10% extra than you, that doesn't matter. The kind of knowledge you will receive by sharing and teaching others will be immense, right? So I always tell my students and my trainees that you should always learn, teach, and then do. Okay. Once you start doing this, then your knowledge will definitely be to the next level. And one of the things that happens when you start teaching others is you will start learning more, right? So when I do these webinars, I have to come prepared, I have to make some slides, I have to do some research, right? So what is happening here is, whether you get benefit or not, I'm definitely getting benefit, right? So my learning is definitely improving. So always try to, whatever you try to share with others. When you share with others and others ask questions and doubts, then your clarity will be improved. You will be definitely a better version than the previous version, right? So always do this and practice this forever. This is not just during the college time. Please practice this even after your college life. This is something which will remain with you forever. Yes. So
Yes, sir, definitely. Very well explained. Sir, I want to ask one more question that as you have mentioned about who can go for this job like B Farm, Pharmacy, and M Farm. Sir, is there anything like I have heard sometime like if you are just plain B Pharma, you may face some kind of problems later on. You should do M Pharma, or you can go for PhD also. So is there any kind of compulsion or necessary, like we should have higher degrees?
Yeah. So let me, tell this in a very simple statement. So always, higher education is required. Whatever field you go. So for example, if I am hiring and if I am getting, resume of a PharmD and a PhD and a B Pharm, and the skills and understanding of B Pharms is better than M Pharm, then also I'll prefer to go for the higher study, because a higher study person, because his level of understanding would have been definitely better than B Farm. The reason is he has studied for a longer time, right? He is more mature, he is more able, he can be more better, right? And also most of the clients, they prefer to have people with higher education only. The moment I say that I have a B Farm writer, they'll not prefer. They want people with higher education to write. The objective is very simple, that the people with higher education will have better understanding, better knowledge, because they would have studied for a longer period. I'm not saying that B Farms will not have knowledge. B Farms will definitely have a good knowledge as well. But when it comes to degree always acts as an entry point into an organization, right? And better degrees are always a preferred ones. Even I have seen a lot of B Farms who are doing better than M Farms, but then because of degree, they do not go to the next level. Degree becomes an obstruction there. So if you want to scale higher, then always have more degrees, better degrees, and these degrees can always be done even when you are like doing your job. Like you have a lot of options these days, thanks to COVID. Today you can do degrees from international universities sitting here in India, right? So a lot of opportunities have come, and always try to upskill yourself. Don't feel that just because you're financially you had issues or some other problems, you could not do degree. If you have to get into job, spend time. All of us have 24 hours, so you can always divide your time accordingly, and add value to your life by adding more degrees. Degrees are always a welcome thing when it comes to jobs. If you are a solopreneur or entrepreneur, then it may not be of so much of importance. But if you are joining for a job, then degree is definitely a needed one.
Okay, sir. Sir, is there anything like in the field of medical writing, will the companies will they accept the particular kind of masters, like as you have mentioned about the diseases and the pharmacology of those diseases, then pharmacology or some person from that stream only?
Yeah. So this used to happen, when I got into medical writing. I was doing my M.Pharm in pharmacognosy, and pharmacognosy was not supposed to be a field of acceptance in medical writing. But then I got in, and then I have been there for last 15 years. But as a rule, most of the companies, when they start hiring, they hire for M.Pharm pharmaceutics, M.Pharm pharmacology, M.Pharm pharmacy practice, M.Pharm clinical practice, PharmDs or PhDs. And nowadays, many in MNCs and other companies, they have started hiring MBBS MDs also in medical writing, because their therapy knowledge is very, very good, right? Our medicine knowledge is good. In pharmacy, our medicine knowledge is good, but their therapy knowledge is very good when it comes to MBBS. And they have more practical exposure than pharmacy students for sure.
Yes, sir. Sir, that were the all questions. One more question I have, sir.
Yeah.
Like as you have mentioned that the student should have a better communication and all the skills. So can you mention some things or some platforms where student can like practice these things and can grow up in these things?
Okay. So obviously,
And one more thing, sir,
yeah.
sorry for the interruption. And one more thing is this, like as you have mentioned some masters, if a student is from other streams, so what extra things he can pursue so that he can go into medical writing?
Yeah. So basics is always needed. Okay. Basics of pharmacokinetics, dynamics, mechanism of actions, human anatomy and physiology. These are the basics, irrespective of any department we should be knowing, right? We have studied in B Pharm and then M Pharm also. And whatever subject you are in, you should master that subject. You should be an expert, right? That is the first thing. And you should be open to learning. You should not feel that, okay, since I have done in pharmaceutical chemistry, I don't want to learn pharmacology or any other subject. You should be open to learning. If you're open to learning, you can learn anything, irrespective of any domain, right? So go for learning and be open, be curious. Curiosity is something that is the requirement today. If you're not curious and you don't want to learn, then you remain where you are, right? So we should always be curious. And I should tell you one thing, okay, even after 15 years in this domain, I still feel that I'm still lacking so many things. I still learn. Whenever I'm working on a new project, I find something interesting, and I can always learn something new from the new projects. And I have been learning from the juniors also. The juniors, when they join, the freshers, the college students, they have a lot of skills which we lack at this point of time, especially the digital skills, the computer skills. They are the masters, okay, because they have born with digital tools. They are born with smartphones, so obviously they'll be much more better than us. But definitely these skills can be learned. The only thing is we should be curious and show our interest. Okay. Okay, so one question I can see from Hemant is, what are the different apps and softwares which you can suggest for grammar correction? So for grammar, the most widely used tool is Grammarly. You can use that. It's a free, you can just create a free account with them, and you can use on your browser, on Microsoft Word, on PPTs, everywhere. So Grammarly is the one which I'll recommend. But then over a period of time, if you are a writer, what you can do basically is you can start compiling your own words, right? For example, since last 15 years, I have compiled about 150,000 plus medical words in my own dictionary. I have created my own dictionary that goes with my writing tools if I use a PowerPoint or a Microsoft Word. So similarly, you can keep on adding value to your own self, because these things you will not get outside, right? So you can always do that, and definitely this will help you out. And always use the latest softwares, because you'll have so much of validation with the latest ones. Don't use the pirated ones. The pirated softwares will have always problems. Initially, frankly speaking, when I started my journey, I also used to use pirated softwares. But then you don't get the updates. You'll have so much of problems. The system will hang, and so much of issues will start. But then if you go for it, it is like one-time investment. But once you invest, definitely you can be in the better zone than rest of the people who are there in the medical writing. Yeah.
Sir, as you have mentioned about the project, so can we know that like what kind of projects are there? Not exactly, but like what a medical writer is supposed to actually play a role in that, like in the Roman language,
Yeah.
so that
Okay.
the
So
students can
correct.
understand.
So if I have to explain the different types of project, it will take about 4 or 5 hours for me to explain the whole types of projects. But just to give you some ideas, one type of project that medical writers do is publication writing, which is for journal publication. So you see all these manuscripts, review articles, case reports, right, which gets published on the journals. They are mostly written by medical writers. And the second, for all the pharmacy students, because I assume most of us are pharmacy students here. So if you're a pharmacy student, and if you have gone to a doctor's clinic, if you know that some of the marketing representatives are working in pharmaceutical companies, so whatever these marketing representatives carry with them to the doctor's chamber or to the chemists, druggist, or pharmacists, you see all these inputs, right? The product monograph, the visual aids, all of that, doctor reminder cards, e-detailers. So all of that content is created by medical writers. And these are called as medico marketing inputs, because they are ultimately medical, but they are used for marketing to the doctors and other healthcare professionals. They are called as medico marketing inputs. Then you have this clinical study reports. Whenever the clinical studies are conducted, a lot of data is generated. So all those entire data, like you'll have thousands of pages of data and Excel sheets which will be generated during the clinical studies, right? So the entire data cannot be published. So what the medical writers and the teams will do is they'll concise that information into readable format for the public, for a layman, and then they'll actually concise everything and then publish it. So they're called as clinical study reports and all those things, right? Yeah, so there is another question from Vishnu. Please tell about pharmacovigilance. So Vishnu, I'm not an expert in pharmacovigilance, but pharmacovigilance is another domain which is highly sought. And this domain, people mostly work on adverse reactions and finding different things related to drugs and disease. Okay, so I have done a couple of webinars on this topic. You can just go and watch on my YouTube channel. It's a very lengthy webinar. It talks everything about pharmacovigilance, the various career opportunities and everything. So you can always, there are 40 plus different career opportunities that I know immediately. I can tell. You can go and watch all of them on my YouTube channel. Yeah, Aarti.
Yes, sir. Yes, sir. I will give the link of your YouTube channel, sir, in my description, so
Yeah.
students can find it easily. Sir, one question I have from my side, many students are like they are confused, like where they should go, if they will enjoy this job or not. So I have one basic question, like if a student want to consider medical writing as their career option, what kind of qualities or what kind of skills they should look into their themselves, like
Okay.
yes, I like this thing and this job demand these things, so I can go for this job.
Okay.
Sir, I hope
So
you are getting my
yeah,
question.
I got it. So if you want to get into medical writing, you have to be in the zone of medical writing. So what I mean by zone of medical writing is you should be connected to people who are in medical writing. You should know what is happening in the field, what they do as medical writers, and you should then get inspired, right? So if you want it, this is not just for medical writing, this is for everything. Whatever field you want to get in, whatever is your future career plan, okay? Most of us, in pharmacy especially, it happens. Most of us go in pharmacy as a chance, not by choice, right? So when you go in as a chance, and you do not have so much of information with respect to career opportunities, the best thing is to do is to connect with people who are in the industry. And how do you connect? Start from your alumni. Okay, most of your alumni, college alumni, whichever college you are studying, you'll be definitely have a lot of college students who are already in job, right? So connect with them, ask them what is happening, what is working for them, and also understand whether you can get into that zone or not. You should do this right from first year B Farm. So I see a lot of students when they complete final year B Farm, they start sending resumes suddenly, sir, get me a job. What kind of job? They don't know. Which industry? They don't know. Which place? They don't know, right? So you have to be in the zone from the beginning. You should have a focus. I know a lot of students who have decided their mind when they're in third year B Farm that they want to do M Farm and they want to do pharmacology or clinical practice only. Okay, they have decided that. How they have decided? Because they are in that zone, they are understanding more, they are learning more, they have an interest in the subject. If you're not interested in that domain or the subject, you cannot do best in that domain. So always show interest, always have that passion for getting into that. Now coming to the medical writing, the first thing that you need is, of course, you should be a avid reader. What I mean, you should read a lot of information, because on a daily basis as medical writers, we'll be reading so much of information, so much of clinical trial data, so much of review articles, so much of new therapy areas. After reading, we should also understand, it is not that you keep on reading from morning to evening, you read and you don't write, right? So basically you have to read, understand, and then write. So these are the three main qualities you should have: reading, understanding, and writing. And writing will happen only if your language skills and communication skills are good. In addition to that, you also need the software skills, like, for example, using Microsoft Office, Microsoft Word, Microsoft PowerPoint, and there are other softwares which we as medical writers use. So you should be aware of those softwares as well. And once you get into the field, then definitely you'll be exposed more on these softwares. But as a beginner, what you can do is you can start learning, and be in the zone. So try to see, for example, you want to get into medical writing, start going to the LinkedIn, connect people who are in medical writing, see what they're doing, how they're doing, and they'll be posting a lot of content. So start consuming them. And if you're really interested, you'll definitely find an interest for it. Okay. Okay, so
Yes, sir.
I see one question from Vaibhav. Is there any need to be an expert in IT for medical writing? Absolutely not. But you should be knowing the basic tools. You don't have to be an expert in IT, but if you know the tools, you'll definitely be better than others, right? So always we want to be better than others. But when we want to be better than others, our quality, our learnings, our skills should be better than others, right? My suggestion to everyone would be to not compare with others. Compare yourself with yourself. What I mean by that, yesterday I was not knowing how to write. Today I started writing, so you are better. Now tomorrow I'll be doing this, so you'll be much better. Tomorrow I'll be doing this, so you'll be much better. So always try to be better version of yourself, and then you can do it. So what about the courses? There are so many courses available on scientific writing. Yeah, you can try that. I suggest anyone who is interested in medical writing to go for a course on Swayam portal. Okay, Swayam is Government of India's portal. It's a free portal, and they have a whole course on scientific writing, which is very detailed one, and you can get a lot of clarity and thoughts with respect to medical writing. Not medical writing, but scientific writing. And for medical writing, you have to connect with respective medical writers and see what they can help you and how they can get you. Because medical writing is different for organizations and institutions, and not a single course in India can teach you everything about medical writing. So this is a very wrong understanding that if you do a certification course from so and so institute, you can be the best version. It doesn't happen, because the requirement in the industry is totally different, and no one can teach everything in these courses, right? Yeah.
Yes, sir, definitely. So these were all the questions, sir. Thanks a lot for your time. I hope
Perfect.
I hope that students have got the answers of their doubts.
Perfect, Arti. Thank you so much for having me here, and I hope I gave some ideas and clarity to the students. And
Definitely, sir.
to anyone who is interested in medical writing, you please connect with me and try to help you out in whatever ways I can, and also connect with you with the training programs that can happen. Okay, so let's connect and let's discuss what we can do. Yeah. Clinical
Yes, sir.
trials and regulatory writing, Vishnu, yes, even in clinical trials and regulatory writing, there is a requirement of medical writing. And regulatory medical writing is another division wherein a lot of, regulatory companies are working in. And clinical writing is another division where a lot of medical writers are working. And you need little different skills than in those areas, because you have to have little regulatory knowledge also. Just having medical knowledge or the scientific knowledge will not help. How these papers are filed, what kind of regulations happen, all those things you should be knowing. And there are a lot of guidelines also which you need to follow when you go into regulatory. So I have also done a video on this regulatory medical writing. You can go and watch there. And Arti will anyways be sharing the link. So you can always connect, and then we can always discuss. And feel
Definitely,
free
sir.
to get connected. And I do webinars every Saturday at 2 p.m. So join there. You will definitely learn something. Learning is the most important thing that we can do to each other. And let's connect, learn together, and make this pharmacy community a better one, because that is the only thing that we can do at this point of time.
Sure, sir. I will give the link of your LinkedIn, Instagram, and every social media handle you have in the description.
Perfect.
And like, sir, as we are in the college, I have just passed out from my master's degree, and whenever any company came for the recruitment, we just have the JDs. We read into it, and we don't know anything like what they are demanding for, because whatever we have learned into our curriculum is entirely different for what they are demanding for. And at
Absolutely.
that place, the people like you who come to us, like who come for our help, and you just fill the gap between the academia and the corporate life or the industry or the sectors. So thanks a lot for that, sir. Thanks a lot for sharing your knowledge with me and my audience also. So audience, I request you to please put one whatever the topic you want next for the next video, so that I can have that video on my YouTube channel next time. So sir, thanks a lot once again for your time and for your knowledge. I hope the questions are ended now.
Yeah,
And
yeah.
yes, sir.
Perfect. Thank you so
Yes,
much,
sir.
Aarti, for having me here, and thank you everyone for patiently listening. And regarding salary, we've already discussed in the entire presentation, so you can rewatch the whole video. and get some idea. And do connect with Aarti or me if you need any support with respect to medical writing or any other career opportunity in the pharmaceutical industry. So Aarti is great, doing a great job by simplifying the whole pharmacy knowledge into basics, especially with GPAT and NIPER, and I'm sure it is helping you a lot. So all the best to you all, and thank you so much for having me here, and we'll connect definitely again. Thank you so much.
Yes, so guys, if you have any questions further, you can just drop the comment below. I will get back to sir, and I will get those answers from sir, obviously, and I will give the answers to your questions.
Perfect.
Okay, so thank you, everyone. Thank you, sir.
Perfect, Aarti. Thank you. So I'm stopping the live streaming. Thank